Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Hello, Strong Moms. Welcome back to Every Mom is an Athlete. Today, we are continuing our series on things that strong moms do and don't do. And today we're talking about why we cannot just do Kegels as our postpartum rehab. So let's get right into it. Somewhere along the way, I feel like so many women have learned that postpartum recovery is just basically just do your Kegels. Do your Kegels, you'll be fine. Like I've heard so many of my patients tell me that they've heard this from their OBs. And it's truly just not a good enough answer because granted, while most people newly postpartum, we're talking in the first couple weeks, most people could use some strengthening of those muscles, okay? In general, if you've had a vaginal birth, they have been completely stretched out and they need to be recoordinated with your breath and with how your whole core is working. But just contracting them is not really enough. And that's not even talking about all the women who are a little farther postpartum who are dealing with leaking, maybe back pain, maybe heaviness, or pelvic pain, or feeling weak during workouts, or having painful intercourse, all these things. These can be symptoms of a tight pelvic floor as well as a pelvic floor that's not strong enough. So just like all the other muscles in our body, we can't just necessarily think like, oh, okay, well, it's not strong enough. Let's just tighten it, strengthen it, when maybe it needs to be stretched. Maybe it needs to be loosened. Maybe it needs to recoordinate with all the other muscles and the joints and everything around it. So let's get right into talking about the entire system and how it all works together. When we're talking about the pelvic floor, I like to explain it to my patients as a barrel, okay? It's very simplified, oversimplified, obviously, but just think about it this way. So the bottom of the barrel is your pelvic floor. The top is your diaphragm. So that's your main breathing muscle. It's right underneath your ribs on that front side, okay? And then you have your deep core muscles, you have your glutes, you have all the hip musculature. All of that is connected in and kind of makes your core. And so when we're thinking about healing the pelvic floor in newly postpartum, what we need to think about is, okay, we need to recoordinate the way that pelvic floor, the bottom of the barrel, works with the top of the barrel. The way that they work is when you breathe in, they both move down automatically. You can think of like your lungs are filling with air, so everything kind of moves down. And as you breathe out, they both automatically move up. So this is just the normal rhythm of how they move as you breathe. And that is why I'm always stressing breath work so much, especially to new moms, because when we're using that breath work, when we're using our breath, we're automatically recoordinating our pelvic floor with our diaphragm, so the top and the bottom of the core, right? And we're not having to think about, okay, now Kegel, squeeze my pelvic floor, all these things. No, we're doing it automatically. And anytime you can do something automatically, it's going to become more natural for your body rather than having to think like so hard about doing something. So when we think about the way that most women experience their pelvic floor, lots of women actually have too much tension. We end up kind of over gripping in either our abs or in our glutes, which puts us in a poor position in our pelvis. Okay. I remember with my last baby, especially, I would constantly find myself, like, let's say when I was making dinner or if I was changing her, with my glutes just like clenched under me, like squeezed under me for no good reason. And I remember talking to my patients about this, and I'm like, no, this is not what we're supposed to do. What we're trying to do there is we're trying to create stability because we don't have it yet. And that's a sign that, okay, we need to be doing some work in our pelvic floor with our core and strengthening that, because that's what our glutes are trying to do. They're trying to like create the stability for us. And so that's one way that women can kind of experience these pelvic floor issues. There can be also poor coordination, right? I see women breathing backwards, basically. So they're like, stomach is going out when it should be going in. I see them with weak hips, especially maybe on one side, glutes that aren't quite firing and stabilizing properly. All of these things we can often trace back to the pelvic floor, because if we're weak there, all these muscles around that attach, they're going to try to compensate because our body's just so smart, right? Our body's trying to keep us up, keep us moving, keep us stable. So all these things are going to be compensation patterns, when really what we need to get back to is the root of the problem, which could be, not always, right? But could definitely be the pelvic floor. one question I often get before we go on here is about C-section moms. And I just want to reiterate that C-section moms also often, I would say almost always in my office, I have them do a little bit of work on pelvic floor retraining, because even though the baby didn't come out that way, the baby was still growing in their abdomen for 9 months, right? And so that's a lot of pressure down into their pelvic floor. And especially if they were working out through pregnancy, especially if they were lifting and maybe didn't exactly know how to use the breathing and bracing techniques properly, it can be a lot of additional strain on the pelvic floor. So I have pretty much everyone do some kind of reconnection work, especially early in postpartum, with their breathing, with their bracing, engaging their transverse abdominis or their deep core muscles with that pelvic floor connection. So what does that look like? Let's say you came into my office and you're newly postpartum. Let's say you're 4 weeks postpartum, and you're like, Karlie, I haven't done anything. I'm feeling pretty good, but I definitely feel weak. My core is mushy. I feel unstable. Like, what are we going to do? I'm going to start you with diaphragm and pelvic floor breathing and connection. Okay. So what that's going to look like, I would have you place your hands on your ribs, sort of on the sides. You're going to breathe in all the way around. I cannot talk about this without doing it. You're going to breathe in all the way around. So that 360 breathing, letting those ribs really expand. And then after we've got that working properly, right? Because sometimes that takes a little bit because your ribs and your diaphragm and everything has been so crammed down from having a baby in there, taking up all this room. So sometimes that takes a little bit of work. But once we can get that going, then we're going to start thinking a little bit about what the pelvic floor is doing. So you'll take your breath in, that big 360 breath. As you breathe out, now what I'll have you do is a very slight lift of the pelvic floor. I like to use the cue like you're picking up a blueberry with your, lady parts, okay? Very slight, don't crush the blueberry. And then also you're going to try to pull the two hip bones together ever so gently. And that's going to start getting that transverse abdominis or those deep core muscles engaged. So what you're not trying to do is just flatten out your abs. You're not doing crunches. We're really trying to reconnect this movement of this whole barrel, right? So that it's working together. And then we can get into some of the more sexy stuff to build and strengthen your core. Now, I'm often going to, again, if you're my 4-week postpartum patient, I'm also going to probably give you some glute work, okay, because the glutes are directly connected into the pelvic floor. And I think this is what gets missed a lot in newly postpartum rehab is the glute work. So we're going to work on our hip mobility, making sure we have full hip mobility. And then we're also going to work on stability of the lateral hips and firing of the glute muscles. So hopefully that's going to turn into like 3 exercises max for you. I always try to keep things that I give to especially new moms, 3 or 4 things. That's why in my postpartum plan, each day, it's only like 4 things max. I think actually a couple of days there's a mobility piece that makes it 5. But 4 like solid exercises is really all I ever give people, because they're just more than that. It's just too much. It's just too much to wrap your mind around. But you can do, supersets of 3 to 4 things or break it up throughout the day, however that looks. But those are the things that I would recommend. Engaging the core with the breathing and bracing, some glute work, some lateral hip work, and then some mobility of either the hips or, of course, the upper back. Because, if you're a new mom, often you're nursing. If you're not nursing, you're still holding that baby, feeding that baby so much. And so our upper backs just get so locked up. And again, it's all connected, right? So if your upper back is locked up and stuck in that crunched forward position, that's going to also change the way that your lower back and your pelvis moves. The other thing we want to do is what we call progressive overload. And this is the way that all strength should be programmed. If you have someone programming for you, or if you're following any kind of fitness program, you're going to have some progressive overload. That means that you're not overwhelming your body. Boom, like all of a sudden you're squatting 200 pounds. No, of course not. You're going to start with an air squat, and then you're going to add a little bit of weight, and then you're going to try a couple different kind of squats, maybe a front squat, maybe a back squat, maybe a goblet squat. Then you're going to start loading up the weight more and more. And so you're progressively training your body with this gradual strength exposure to get stronger. And that's exactly what we do with pelvic floor work, okay? It doesn't look like that, but we're going to start by engagement. Then we're going to start by adding a little bit of load. And yes, carrying your baby counts as load. And so there's lots of things you can do throughout your regular day that you can work into this pelvic floor work thinking about bracing your core, thinking about kind of lifting that blueberry, thinking about breathing, 360 breathing while you're walking around with your baby, while you're doing things around the house. It doesn't have to be this whole big, like, sit down and do a session of half an hour of rehab. It's crazy to me too, to think about the fact that we don't get this information like straight out of the hospital, right? You wouldn't have ACL surgery and then not have a game plan, right? Not have some kind of rehab plan. And by the way, the rehab plan wouldn't be, oh, just squeeze this muscle 10 times at every stoplight that you stop at. And that's going to fix your knee and strengthen your knee again so you can get back to doing the things you love. No, they would never say that. But somehow that's what we think we do with the pelvic floor. So I'm not going to get off my soapbox, but let me just like step down a little bit on the soapbox here for a minute. Another thing I hear from a lot of moms is that they feel like this is normal. They've heard this is normal, having leaking, having pain, having issues with their pelvic floor, not feeling weak. Definitely the leaking part, especially when you're jumping, running, sneezing, that sort of thing. And I always say, just because something is common does not mean it's normal. And if you're having those symptoms, whether you had a baby or not, honestly, it means you have some kind of dysfunction going on with your pelvic floor. And you should really have it evaluated if possible. Find a pelvic floor PT near you. I always just recommend at least getting in for one visit to have an evaluation so that they can do an internal exam if you're comfortable with that, because then they can really feel like, oh, are you able to contract those muscles? Are you able to hold the contraction? So do you have endurance to contract the muscles? Are you able to powerfully contract and relax them? It's not about just the contraction. It's also about the relaxation. All of this is well and good, Karlie, but give us some more tangible things. Okay, so what should you focus on? First of all, stop Googling random exercises, okay? You need a plan, something that you can put in place and follow. It's about the consistency, right? If you're doing 20 minutes of pelvic floor work once every week or 2 weeks, you're not going to get very far. It's more about doing little things throughout the day, every day, or most days of the week. I also recommend, if you are having pelvic floor issues, first of all, I already said it, get in to see a pelvic floor physical therapist, but you also want to make sure that you have full range of motion in your joints. So working on your hip mobility can really help. And then you also want to make sure that you're breathing properly. So like I said, when you take that big breath in, your belly should expand out. And when you breathe out, your belly should go in. So it sort of sounds like opposite, but again, you're filling up your lungs with air. Everything kind of puffs out when you breathe in. And then it goes back in as you push all the air out. So check on that. You want to make sure that you're breathing properly there. And then you can always start with some Kegels, right? You can make sure that you can contract, but you also have to make sure you can fully relax. So if that feels hard to understand, like, am I doing that? Am I really relaxing? That's when you might want to get in to see someone to get an evaluation and just see where you're at with that. In my 15 plus, oh my gosh, almost 16 years as a chiropractor and strength coach, and now a mom of 3, I have seen women completely change how they feel postpartum once they start focusing on their full body and their postpartum recovery, understanding that Kegels could be a part of that, but it's not the whole thing. So if you are a new mom and you haven't done anything, definitely check out my postpartum plan. It's an 8-week plan, 20 to 25 minutes a day, 4 days a week. And like I said, simple exercises that you can do either in a superset or you can do them throughout the day, adding them in for little movement breaks wherever you can, if you can't find that big chunk of time. But you need to do something to have this smarter rehab approach, especially if you're having any pelvic floor symptoms at all postpartum. All right, strong moms, I'll put the link below to check out my postpartum plan. Of course, if you know a new mama who is just feeling confused, not sure where to start with her rehab, please send her this series. I think it will be so helpful. We're going to go over so many other things that lots of moms have heard they should do and debunk some myths and give you a lot of good advice around that. All right, until next time, have a wonderful week and stay strong.
Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.